Doctors and Tayside are trialling an online app to ensure dying patients get the correct amount of pain relief. Spot allows medical staff to double-check dosage when changing opioid medicines. These can be complex calculations. If they're not correct, they can leave a patient with too little pain relief or risk overdose. Our innovation correspondent Laura Goodwin reports.
The patient was receiving her pain relief and her food through a tube that went into her stomach, and I was asked to see her because that tube had blocked.
2 weeks after graduating from medical school, Dr. Roger Flint was covering 3 wards on a night shift when he was asked to change a dying patient's method of pain relief.
The nursing staff asked me to change her from the tube pain relief to an infusion under the skin. I found it quite difficult to perform that calculation, and I asked for some help to double check what I'd done. But unfortunately my senior doctor wasn't available, and so that patient went without pain relief until I could get some more help.
It's a situation which has haunted him, but also inspired him to come up with a solution.
The patient was on morphine, and she was receiving that orally.
The Spot app is an online tool that will double-check calculations made by medical staff, ensuring a dying patient is given the correct dosage of pain relief as quickly as possible. Now it's being trialled at the Margaret Care Palliative Care Unit in Melrose.
In the past I've always done that by doing the calculation one way and then doing it a different way and checking that I come up with the same amount. Sometimes if there's another member of staff, we'll ask them to do it, but there's not always someone there available, so actually it's really useful. We often say you only get one chance for things, but I think particularly with end-of-life care it is crucially important.
But increasingly end-of-life care happens at home, supported by nursing staff or out-of-hours GPs. Dr. Scott Jameson from Dundee is also using the app.
I recognise the distress that I'm going into, and I'm trying to support that. I want to make sure that I'm confident as well when I'm doing my conversions in these, it's late at night or early hours of the morning, that I'm accurate in my conversions.
A number of other health boards are now looking at trialling Spot, and it's hoped it could be adapted for use with other types of medicine.
I designed Spot to make sure that no other prescriber would be put in that position again. And if I'd had Spot at that time, I could have confidently performed that calculation, double-checked it independently, and that patient would have received her pain relief on time.
Laura Goodwin, BBC News.